Hi, everybody, and welcome to the August Lymphedema Patient Roundtable hosted by Lymphopress. A lot of you know me. My name's Alexa Ercolano. I'm the Marketing and Communications Associate here at Lymphopress, and I also have primary lymphedema. And we are just so pumped you're with us tonight. We've got a lot to talk about, as always. So while you're logging on, I'm going to introduce our panel. We've got some new faces and an empty chair that will be filled soon with another familiar face to some of you. So I'm going to start going around my screen here. We have Catherine Rosenberg, pediatric cancer survivor living with secondary lymphedema. She's an advocate. She is a math teacher on summer break, so no math questions yet. And as you can probably tell, she's coming to us live from a hospital. So send all the good vibes to Catherine. She's our girl, and we want her feeling better soon. We have Karen Ashforth, certified lymphedema therapist and fibrosis extraordinaire. Hi, Karen. And we also have Dave DeBacco, who's a Renaissance man here at Lymphopress. He's a wealth of knowledge about anything Lymphopress. So if you have any questions, pump related or insurance related, he's your guy. So go ahead and drop those in the Q&A box. And we have Olivia Eggers, who I'm so thrilled she's with us tonight. Olivia is a global primary lymphedema patient. That means she's got it all over. So she has lots of experience to speak from tonight with living with lymphedema. And she's also passionate about disability destigmatization and acceptance. And she is a wonderful singer to boot. And she was with me and our other guest, Dominique, at Camp Watchme this past month. So we're going to talk a little bit about that in a bit. And that empty chair in the fire station is Dominique Rogers. He is a firefighter and EMT living with primary lymphedema as well. And he's got an awareness brand called The Process to Progress. So you may have seen him on Instagram with that. So that is great. He's working, obviously, as you can see. So he will be popping in and out as he's able. So I know I'm talking a lot. So another little bit of housekeeping before we get started. Put your questions in the Q&A box, so we'll answer them about 30 minutes, 45 minutes through the evening. We are not your doctors, but we're your pals, so we'll speak to you from our experience best we can, and we'll defer to Karen as our clinician on the panel, to our therapist, to talk about general medical questions, but we're not going to give you personal medical advice. And at the end of the evening, Karen's going to lead us through a lovely meditation to close it out. So give us a shout in the chat. Let us know that you're here, and we're going to get into it. And I'm going to put Olivia on the spot to start because I've talked enough already. Olivia, we were hanging out in the Rocky Mountains with a group of pediatric lymphedema patients a couple weeks ago. Can you talk to us a little bit about Camp Watchme, what it is and what it meant for you as a first-time volunteer and a former pediatric lymphy kid yourself?
Yeah, absolutely. Thanks so much, Alexa. And such a great question to start off with. So Camp Watchme, for those who don't know, is the only camp in the United States for kids with lymphedema. Kids come there for a few days of a session and go through, all the normal camp activities. They do archery, they do things like that, but they also have the opportunity to connect with CLTs and do things related to their lymphedema, learn about bandaging, learn about compression, all of those great things. And this is actually my first time at camp, which I was super excited about. I followed it on social media for many years, but didn't have the opportunity to come myself. And I will say it was the most fulfilling experience of my life. Getting to be with those kids in that environment is unlike anything I've ever gotten to experience. Kids come here and lymphedema is so normalized, and they all look at each other and they see themselves in each other. They don't have to explain why they're wearing compression or why they have bandages on, and they just get to exist. And it was amazing to get to see them be so confident and so authentic, and to get to share my own journey with them and hear from them. Like, I went there hoping I could reassure all of them in how successful they would get to be in their lives, but I don't think I didn't take into account how much they would reassure me. And they just made me feel like I was in such a place of belonging. And it was just such a beautiful place, much better than Disney World, in my opinion, though no hate to Disney. But yeah, so that's a little bit about camp, and I'm just so glad I got to go.
Well, it was awesome to have you there. And Olivia gave a really great talk to the kids and their families about growing up with lymphedema and dealing with the questions that we all have had these. We've all had questions. what'd you do to your leg or what'd you do to your arm and whatever, and it feels very invasive. And Olivia, you gave some really great advice to the kids, and I think us adults could really benefit from that too, because it can feel so invasive or embarrassing or annoying when people ask these questions. Can you kind of talk a little bit about how you've dealt with questions over the years?
Yeah, absolutely. I mean, I have 27 years of being asked pretty invasive questions about my body. And when you're a child, you're not necessarily wanting that extra attention on yourself. And it's not just kids who ask, it's also adults. Because I think as humans, when we see something that is unknown to us, it comes from a place of ignorance, of wanting to understand, but also feeling unsure, feeling uncomfortable, feeling scared. Sometimes people say things that are not very nice, or they ask questions that are not very polite. I've gotten, "What's wrong with you?" more times than I can count. I was probably asked that about 5 times a day from the age of 5 until 22, when I finally started being able to answer those questions for myself, because there was so much shame ingrained within me when it came to these questions. And all I wanted to do was push off this lymphedema label and not have that define me. But in doing so, I also really restricted myself. So something I told the kids, because they were asking, about these questions that they get. Were you stung by a bee? Were you bit by a spider? What's wrong with your hand? What's wrong with your leg? No one is ever entitled to know anything about your body. And that is something I really, really believe in. If you do not want to tell someone something about yourself, you do not have to tell them. Your body is your own and your own individually. It does not belong to anyone else. You do not owe anyone any answer. That said, taking into account that you can answer questions when you want to, something I have also learned as I avoided questions for probably a good 15 to 20 years is when I did finally start asking these questions, even when they were invasive and sometimes rude, it normalized lymphedema for me. The more I got comfortable talking about my lymphedema and sharing it with others, then normalized it for those other people who were asking questions too. So something I really wanted to share with the kids is this idea of like bodily autonomy. It is totally yours. Someone asks you something rude, you can say, "I don't want to answer your question and I'm going to walk away." And that is okay to do. But there also gets to be this really beautiful point of understanding and acceptance when you're in yourself, when you're able to answer those uncomfortable questions and educate someone else on who you are and what you have. And I, didn't say the word lymphedema for probably 20 years, finally started saying it, telling my friends, this is my disease. This is what it is. This is why I wear these compression stockings. And now I have experiences all the time where friends will be like, "Oh, I met someone today who had lymphedema and they actually haven't had a lot of medical help with it." So I was able to give them like some advice and recommendations on seeking out a CLT and looking into compression. And I wouldn't have been able to do that had you not educated me. So those are two big things I push. One, bodily autonomy, but two, beginning to understand and accept yourself through answering those more difficult questions. So I'm glad I got to share that with the kids.
I loved that. And I always think about it. I call it lymphsplaining, like what you have to explain your lymphedema to people. And I kind of keep a little Rolodex in my brain of different levels of response depending on my mood, engaging what the asker, like, are they coming from a place of genuine curiosity or concern? Or are they just being kind of rude? What's sort of going on? We got a private chat to the host that said, "This world is messed up. I hate to leave the house because people always ask." And I'm so sorry that that's the reality a lot of us face. But like to Olivia's point, we do have the right to not have to answer those questions. And I'd like to open it up to, well, Catherine's our only other patient on the panel right now because Dom's still out. But Catherine, do you have any ways that you deal with lymphsplaining to people? You're a teacher, so I'm sure you get asked by your students, especially beginning of the school year, they might not be familiar with you and your compression garments. How do you field that?
In all honesty, because I teach special education students, I use it as a reality check for them to have them understand that just because somebody has a physical disability doesn't mean that they can't do what they want to do in life. And sometimes you may or may not know that an adult or even a child has a physical disability because it can be well hidden. So I purposely, in the beginning of the school year, will wear skirts and dresses so that this way they can see it, because I only wear compression on one leg, but I have fun with my compression. So 2 years ago, I actually had students, I had parent meetings that I had to go to, so I actually wore my beige compression, which anybody who knows me knows that that is not me. I like to wear my colors. And one of my students told me I had to go home and change because he wanted his parents to meet me for me and not me as the let's be professional.
like that because I think that when it comes to the lymphedema patient community, I think we have a lot of different camps where it's colorful compression and neutral compression, toe caps, no toe caps, or gauntlet. You know, so we all have our little kind of things. I'm a neutrals girly. I always wear beige or black or whatever, but I love the people who rock the colorful compression because I've said this before on the roundtable, but I think just being out in public with your compression visible is like an act of awareness and advocacy for our community. And it is normalizing it for people to see that and realize like, oh, that's something kind of unfamiliar to me. Like, what is that? And then if you explain it to them, then they know next time they see someone wearing compression, what that is, what that person might be dealing with. So yeah, that's always such an interesting topic. And the kids, when Olivia spoke to them, they were so engaged and so because they've asked questions all the time at the playground, at school. Kids are asking them constantly what's wrong, with their limbs, or why are they wearing that and this and that. So it was kind of neat for them to have that moment too of feeling like, oh wow, this really awesome grown-up also is asked questions like I am. Like, so it made them feel a little less alone in that. So anyone in the chat, if you have your go-to lymphsplanation, please put it in chat. Let us know. We'd love to hear it because we might add it to our own little mental Rolodexes. So we've got a lot of questions already popping off in the Q&A box too. And one of them actually relates to a topic we were going to bring up already because last month we got a ton of questions and we ran out of time. But in reviewing them before tonight, a lot of them kind of dealt with primary and secondary lymphedema. What are the differences? How does lymph flow? So we thought, oh, this might be a good time to have a little bit of like a primer on lymphedema, primary and secondary, the lymphatic system, all that good stuff. Because I see a question in the Q&A box right now that said, what is lymphedema? How does it differ from other edemas of the legs? So Karen, this is right up your alley. Would you mind teaching us the ways of the lymphatic world?
Sure. Thank you. Well, I'm going to explain things to all of you the way that I would explain to my patients. And first off, what's the difference between edema, lymphedema, and swelling? So swelling is the body's response to something. It could be trauma, it could be an infection, it could be all kinds of different things. And generally, swelling starts as a protective response. For instance, let's say, God forbid, you break your arm, it's going to swell because that's what your body does to create like a cast, to immobilize the arm so that you're not using it and it has a chance to heal. Well, sometimes swelling can be caused by other things. That can be genetic. It can be caused by surgery or trauma. There can be different imbalances in the body. And so what we generally recognize is that if someone has swelling and it's been more than 3 months, that's kind of the cutoff point where we consider it to be an ongoing or possibly chronic condition. So at that point, it could be considered lymphedema, because lymphedema is not acute swelling. It's very different. Lymphedema is swelling that has persisted for over 3 months. So that's kind of the simple answer. Now, there's primary lymphedema and secondary lymphedema. And the easiest way that I know to answer that is that primary lymphedema is something that you have somehow been born with a tendency towards swelling that kicks in at some point in your life. And some people, like some of the kids that you guys saw at Camp Watchme, some of them have had it since they were born and they came out with swelling. And other people may not actually show swelling until they are later in life, maybe their 50s or 60s, and it can happen anywhere in between. And sometimes there can be an event that kind of kicks it off. Sometimes it can just sort of creep up. So that's primary lymphedema. And another way of looking at it is that in primary lymphedema, there's something wrong with the lymph system. Either there aren't enough lymph vessels or they're too lax. Something with the structure of the lymph system may not be quite right, which makes it harder for the body to be able to move fluid out. I'm going to back up just a minute before I talk about secondary lymphedema and just talk about the lymph system in general. The lymph system, I consider to be the sewage treatment system of the body. Basically, it collects all of the cellular garbage. So dead cells, bacteria, viruses, even cancer. And there's a lot of digestive waste that gets moved through the lymphatic system. And so these little vessels, which are similar but a little different from the blood vessels, they pick up all this waste and carry it to a group of lymph nodes. And the lymph nodes act like a sewage treatment plant. And they break down the garbage so that it can then safely leave the body. And the way that it does that is once the dirty lymph has been processed at the lymph nodes, it gets channeled, all of it, up to the venous angle at the neck. That's where the blood pressure is the lowest. And so the clean lymph actually enters the bloodstream, and then it filters through the kidneys and gets excreted out of the body as urine. That's why when you do a pump treatment, or you have a lymphatic massage, or even going in a swimming pool where you have a lot of water, hydrostatic pressure, you'll need to go to the bathroom because that's lymph wanting to leave your body. So that's a good thing. So let's talk about secondary lymphedema for a second. Secondary means that the lymphedema is secondary to something, to an actual event. And a lot of people have secondary lymphedema because of surgery, often cancer surgery. Radiation therapy is another way that the lymph system can be affected. And what happens with surgery is there's a scar which can barricade lymph flow. And with radiation therapy, it's like a big old scar in a huge area that can also affect lymph flow. Sometimes lymph nodes are radiated, and that makes it harder for them to function. And then there's all kinds of other things that can create disruption in the lymph flow. So while primary lymphedema is a genetic predisposition, secondary lymphedema is caused by something that's happening to a person in their life. And at the beginning, Alexa introduced me as the fibrosis queen extraordinaire, because what I learned a number of years ago is that for many people who develop hardened tissue, it could be a scar, it could be from an infection, it could even be from a buildup of years and years of swelling. And that extra tissue can interfere with good lymphatic flow. So I have really been dedicating this part of my career to really looking at what are ways that we can help to work with this scar tissue, this fibrosis, this hardened tissue, to make it softer and more flexible so that we can have better spontaneous lymphatic drainage. So I'm going to stop here because I've been talking a lot, but I hope that that's given a little bit of explanation about what is lymphedema, how is it different from just plain edema, and what is primary and secondary. So these are some real basic answers. And if someone has follow-up questions, we can grab it later if we have time.
Thanks, Karen. That was a really wonderful explanation too. I appreciated that. And I know everybody watching appreciates that too, because we live with this and sometimes we don't even really know what the heck is going on or what's wrong with the plumbing. So I appreciate that. And while Karen was talking, we had Dom come back, and Dominique Rogers, as mentioned earlier, he's a firefighter and an EMT who lives with primary lymphedema, and he's at the firehouse right now, actually. So welcome, Dom. We're so glad to have you on the panel tonight.
Hey, Alexa, happy to be here.
We were talking a little bit up top about camp, because you were at camp with us too, and this was your second time going. What does camp mean to you as someone with an adult with lymphedema and seeing those kids and their families? What does that kind of bring up for you?
I think it's kind of crazy how uh I wish I had it when I was younger, first and foremost. It's a great experience, a great opportunity to meet different people like me, different kids like me, parents that are dealing with it in their own way, kids that are dealing with their own way. I think that it was, I went there the first year and it was just the kids tired me out. It was great, just playing with them in the pool, playground, everything like that. Letting them be kids, you know what I mean? No one's asking them questions about what their condition is and whatnot. And at the same time, having them see someone like me. I'm sorry. 1 second.
Is there a fire?
I gotta go. I'll be back.
No worries. No worries at all.
All right. I'll hold that thought. I'll be back. All right.
Yes,
Sorry.
we'll be here.
All right.
Yeah, well, I think for a lot of us, seeing kids with lymphedema have a chance to be among people that understand them, like intrinsically, is a really beautiful thing. And like Dom said, it's something I think we all wished we could have had when we were that age. And it's so wonderful that it exists now for the next generation. So that's a lovely thing. We were chatting a little bit before the show in our pre-show emails about massage therapy and lymphedema. And obviously, unfortunately, we can't really go to the clinic once a week to get MLD and have that covered by insurance as much as we would like to. It's just not how insurance works, unfortunately. So a lot of people I know have seen, I mean, lymphatic drainage massage is like everywhere nowadays, but lymphatic drainage massage for us is a little bit different because our lymphatic systems are a little bit different. So I know we just heard a lot from Karen, but I'd love to hear from her again on how we can safely pursue manual lymphatic drainage if we can't get into a clinic and have it covered by insurance.
Oh, I love that question. And it's really interesting because I was actually with a massage therapist last night who I'm going to be training to take over some care of some of my private patients since I'm moving. And so he had done some classes in lymph drainage, but there's a big difference between spa massage and medical massage when it comes to the lymph system. So a lot of the spa massage is very light and it's a detox. And I'm not slamming it because it feels wonderful, but it's maybe not necessarily therapeutic for people who have chronic swelling and or fibrosis. And one of the beautiful things about manual lymphatic drainage is that it's really assisting the lymph system and helping to move that fluid through stuck areas. And so let's say that you're working on softening your fibrosis, but it's not there and you don't have good spontaneous circulation. Manual lymphatic drainage is kind of like hopping on the bus and getting a ride. So it's a wonderful thing. But as Alexa mentioned, a lot of insurance will pay for lymphedema treatment where you have an evaluation and they set up a home program, and there may be an initial decongestion where there's some manual lymphatic drainage. But most insurance requires that there's new teaching or a certain amount of progress. And we know that lymphedema is a chronic condition. And so at some point, you need to do a program for maintenance. And insurance just is not set up to pay for maintenance care, unfortunately. Some is, but a lot not. So how do you find a good lymphatic therapist? Well, I think that you want to be aware of the two flavors of lymph massage and really seek out someone who has the medical training and actually knows what manual lymphatic drainage is, because that's different than the spa detox massage. And there are a lot of great places where you can look for someone. And if you can find someone who's board certified with the Lymphedema Association of North America, they have more experience generally. But Alexa, do you have that wonderful link that Learn has in terms of, I know you are just like a treasure trove of links of finding lymphedema therapists, because there's different schools that will list their graduates and you can punch in your geographical area. And unfortunately, there's no one central database. You have to go to a number of different sites and kind of search out where you are. But the beauty of that is that if you travel, oh, thank you. Yay, she just dropped it in the chat. So those of you who are looking for a good lymphedema therapist, this is a great way to start, is with some of these resources. But if you're traveling, you can use these links to find someone and book ahead and get a manual lymphatic drainage session when you're at your destination. So those are my pearls of wisdom. Anyone else?
Those are wonderful pearls. And I know Angela, who couldn't join us tonight, but she's usually on the panel. She's a big proponent of looking up therapists before or after her travel, or find someone where at her travel destination. She's like the massage queen. She knows how to get it done, which is great. And we're getting some great more resources in the chat. And just a reminder, if you're in the chat, make sure that the to field says everyone and not just hosts and panelists, so that way everyone can see the resources you're sharing. And I'll make sure they're included in the replay email as well. Catherine.
Another thing you can do, if for some reason you can't find somebody in the area that you're going to, is to book extra sessions before you go and after you come back, to kind of prep yourself and do like a active recovery from that trip. And make sure you bring what you need with you. I know I posted on Instagram a picture of everything that I brought with me to go on vacation to my mom and dad's house, and it was a lot. But it kept my leg intact for the 7 days that I was there.
Yeah, and we actually last fall, we did a really good comprehensive webinar on traveling with lymphedema and lipedema, and we can throw that in the chat once I find the link. But I wanted to jump real quick into our Q&A sesh, because we're getting a lot of questions. And RJ had a question that I think, Olivia, this might be a good one for you, since you wear a lot of garments and have a lot of experience with insurance and getting those garments covered. So RJ asked, are people having any luck getting their garments paid for by insurance? I'm getting ready to try. Any sage advice, Olivia?
Great question, and truly the question of the time, I would say, when you're a patient with lymphedema, is it is so hard to often get compression stockings covered. And I know I have dealt with a lot of problems in the past. When I was a kid, I kept getting denied, and still sometimes as an adult, I am denied for compression garments on the basis of them not being medically necessary, which is so frustrating. But I've had many insurances send it back to me and be like, you're actually going to cover this $3,000 charge because you don't actually need these. And I'm like, yeah, you're right. They're just a fun accessory. Like, I'm just wearing these for fun. Something I have learned, though, is I am ready to go before they even deny it. I get all of my documentation together. I make sure that my PCP is aware of my disease and what it is. I have all of my records. I literally have like 300 pages of them actually sitting next to me because I've been sifting through them for something else. Have all of my records ready to go. Make sure my PCP has my information. And when the time comes when they say you're actually denied, I then get my PCP involved and I have them send an appeal. I myself send an appeal. I was at the Foldy Clinic in Germany, so I've worked with Dr. Foldy before to like get all of my records and the very clear claim that these are medically necessary. So then I can just forward that to insurance. It takes a battle. I've sent many angry emails. I'm not an angry person, but over email, I get pretty harsh if they are denying me something that I need to be able to walk. So I think just being well documented is a great way to approach. I'm sure there are other resources out there, maybe like Learn or others has information on what to do. but I'm just big on making sure that I have my support system in terms of my medical care team ready to back me up when I say these are medically necessary. And then I put up a fight until they give me what I need. And it has worked, but I will not deny that it is difficult and it is emotionally trying, but you got to do what you got to do for your health. And sometimes that means fighting the insurance system. And that is the advice I will offer, along with, many good vibes and support. Looks like Catherine might also want to add to that too.
So the one thing I want to add to is, in all honesty, if your insurance company offers you the ability to get a patient advocate, please utilize it because they're going to help you. When I was getting my new insurance kicked in last year, and they said to me, "Oh, you're eligible for 8 units for the entire year," I went, "Oh, no, that's not going to work because I used 6 at one time." I said, "So that's not going to work." I said, "So I need 6 units, 4 sets times 4 because I want, obviously I'm washing them and wearing them, and you can't guarantee they're going to be dry the next day. And for our lower extremity or patients that have pantyhose style, you don't wear your underwear without washing it. So why should I wear my compression garments without washing them?" And that was the honest reason why I was able to get the 48 pieces of my insurance company, because I provided them with all of that information, and the nurse advocated for me to get it approved by the insurance company. It's been a no sweat all year.
Yeah, we've got some people chiming in the chat. Birdie says that they have Blue Cross Blue Shield Advantage and did not have any problems getting her pumps. I will start pool PT this week, which is great because being in the pool means happy lymph. That is awesome. And Jenna Manto, who actually I met at camp the first time I went a couple years ago, so it's great she's on a camp night. Jenna says she's currently dealing with a denial for her compression garments from her insurance, and her primary care provider is clueless. Taking your advice, Olivia, to gather all my documents for next time, which is good. Good luck fighting the good fight. Dave, do you have any insights or tips for dealing with insurance, fighting insurance? Oh, here's Nazreen. Perfect. Nazreen's another certified lymphedema therapist and a wealth of wisdom and knowledge as well. So glad you could join us.
Yeah, I wish there was a straight answer for that. Dealing with insurance for covering anything really is unfortunately never a smooth or easy progress. Sometimes it is, but a lot of the times it's not. So whatever you're trying to get covered, whether it's a pump or a garment or a procedure or therapy, whatever it is, definitely work with whoever is prescribing that or recommending it for you, and they're probably the ones that have all the knowledge and on how to get that done in a hopefully quick and easy manner would be my advice.
Thank you. And do either of our CLTs, Nazreen, to catch you up to speed, we're talking about insurance coverage, a hot topic as always, but any tips for trying to get your garments covered? And especially, we didn't even touch on the Lymphedema Treatment Act as well, which passed earlier this year after a 12 long years of fighting. Any advice for those in the audience?
So I would say that having your CLT, your doctor write notes, your certified lymphedema therapist or your physician write notes to say why you need the garments that you need, including why you need maybe a daytime garment, a nighttime garment, why you may need something custom, if it may have something to do with the shape of your leg or the size of your leg that maybe you won't fit into something that's off the shelf type garment, or maybe even just the texture of your tissue. So that if you can include as much detail as possible, that really does help. Typically, if I write notes to the insurance companies, they're usually pretty good, or even talking to the insurance companies, that's a problem. It's a lot for therapists to get on the phone. So if we can provide the documentation for the patients and then they can kind of advocate for themselves, that's usually pretty helpful in order to try to get some stuff covered. But I think the more you have in documentation, the better. But I know it's easier said than done too, but if you can go in there and ask your therapist to be very specific on why you need the type of garments you are.
Thank you so much for that. Karen, do you have anything to add on the topic, or I know we've got a growing list of Q&A questions too to jump into, but if there's anything else?
No, I think Nazreen said it all. Beautifully done.
Perfect. All right. Well, we're getting a number of questions about different types of devices. We got a question about calf compression, leg cuffs. We got questions about using a vibration plate while using your lymphopress, and then someone asking about electronic stimulation like TENS, and also a couple questions on acupuncture. So we're going to lump all those together. Does anyone on the panel, I'm just going to lean on our therapists especially, have any insights on any of these aforementioned treatments or devices when you have lymphedema? I know that some might be contraindicated, some might not. So what's kind of the 411 on all these?
To start, I love vibration plates. Many of my patients do have them. I really think they do a very nice job of drawing in all the fluid towards those central lymphatics. Kelly Bell, who was always on here for the longest time, would really speak a lot about the effects on the central lymphatics, and they are doing actually a lot of research studies on it now, which is great and very exciting. I have had patients of mine, just speaking of reimbursement stuff, I have not had any covered by insurance vibration plates, but if your therapy note is recommending them and saying what is medically effective about them and how they affect the lymphatic system, I have had HSA and FSA accounts help to cover them. The one thing I would say is if you are doing vibration plates in seated, be very careful if you have hip or knee issues or back issues, because that shaking side to side can cause a lot of problems, and people I know have definitely had issues with them, but I do really like them, and I would really start them under the advice of a therapist. Everything else, I think you said TENS units. Those are good for pain relief too, but of course, it always depends if you have comorbidities on all of these things too. But I have found with lymphedema, a lot of times the pain is not going to be alleviated right away from a TENS unit, but it's going to require many modalities and the therapist's hands and different treatment to help with it too.
Yeah, there actually is one scientific article that talked about the use of TENS for lymphedema, but I think they were using it in the electrical stimulation realm, because you could turn the TENS up so much that it makes the muscles jump, and then it becomes like an e-stim unit. And really what it's doing is it's stimulating the muscle pump. And I think we can do that a lot better with exercise. So I don't think TENS is widely recognized as a lymphedema treatment. Could be helpful, but it wouldn't be my go-to. And everything Nazreen said about vibration, I don't know if I would use vibration at the same time as lymphopress. The problem with vibration plates, other than the contraindications, are that where do you put it, and how do you balance it? And a lot of people like to lay on the floor with their feet on the vibration plate, but you need to be very careful to support your knees, because it can create almost a hyperextension of the knees. And that's the only way I can figure out using a vibration plate with a lymphopress, is to put it under your feet, because I think it would be really difficult to vibrate if you had it under your buttocks or other parts of your body. I use a vibration plate a lot in the clinic with patients in a seated position with their feet on the vibration plate. And we do manual lymphatic drainage and fibrotic work, and it can be a really lovely synergy. But I'm not sure how I could see that happening with the use of pneumatic compression. Acupuncture does have some evidence in terms of increasing circulation, and they've actually done a bunch of studies to show that people that were concerned about the risk of infection with acupuncture needles, that's unfounded, that they're such tiny little entries. And if people are concerned, sometimes, I mean, if I go to an acupuncturist and I have, let's say I have a needle that bleeds a little bit, I'll just dab a little bit of antibiotic ointment on it. So that would be something that people could do also. But anything that increases circulation is going to help lymph flow. So again, acupuncture is not my go-to, but it can be helpful adjunctively. I wouldn't rely on it as a sole treatment.
Thank you both. We had a question too about, John asked, can you recommend or caution against leg massage instruments? I have the inflatable whole leg cuffs, so I'm talking about the newer calf compression / heat applications. I know that heat can sometimes be a little touchy when it comes to lymphedema. Is there any insights on those kinds of devices other than talk to your therapist or doctor?
I have to be honest, I'm not familiar with what he's asking about, so I'm sorry, I can't really. I mean, we know with heat, it's going to draw more blood to the area, blood flow, which depending what you have going on, sometimes I do like to bring a little bit more blood flow. So again, talk to your therapist. No, but I'm not familiar, so I'm sorry. I'm not sure if Karen knows.
I've heard of them, and I think they're more spa treatment types of things. The heat has a relaxing effect, but I don't know. I'm not familiar with any medical devices that have heat and compression at the same time. There's a lot of ice and compression, especially post-surgery, but yeah, I would echo exactly what Nazreen said. Check with your therapist, see if that's something appropriate for you.
Patricia in the chat had a really great piece of advice circling back to the insurance conversation and reimbursement. She said, every state has an elected insurance commissioner and you have elected state representatives in your district. These people are your allies. If you have particular difficulties with reimbursement and you have your documentation in order, contact these offices. I lost my spot. Contact these offices of these elected representatives and you will receive support on moving your claim through the correct channels at the insurance company. That's awesome advice. Thank you so much for sharing that. Okay, we've got a lot of very specific questions and some about surgeries as well. We had a question from Maranatha who says, I developed a reoccurring seroma following left hip replacement surgery in July 2023. It filled up again this last week and I had my left knee replaced 7 weeks ago. I'm not sure why lymphedema keeps interfering with my recovery from these surgeries and I'm struggling to find a way to get the seroma to drain. We have a lot each month, I feel like, about recovering from surgery and lymphedema, and it's definitely an interference. And I know we've got Catherine who could speak to that and our therapists as well, but what are some ways to kind of deal with post-surgical swelling and why exactly does lymphedema interfere with that recovery process? Go ahead, Catherine.
So I can actually target this from a patient perspective in terms of actually having hip replacement. So I had a hip replacement, but one of the things that we did to help proactively was I actually got compression that somebody who was able to assist me to put on me after the surgery to help reduce the chances of developing a fluid collection in that area. And we actually used Velcro wraps because we knew that trying to get on a flat neck garment, putting somebody, because I wasn't allowed to bend my hip past 90 degrees. So you can only imagine how much a craziness of a positioning that would be when you have a total hip replacement. Not easy. So we got the Velcro wraps where I could guide somebody to tell them, no, that's too loose, pull it tighter, and this is how to do it. And it didn't take forever and a day to put on. But the biggest thing to do is before you have a joint replacement surgery, not only work with the surgeon who is going to be doing the surgery, but try to meet with a lymphedema therapist who you plan on seeing, who's a PT, who can work both aspects, the physical therapy aspect for the rehab as well as the lymphedema aspect. And that way they have a plan in place for what they think is the best type of compression to utilize. And one thing that can help, some hospitals have it, some don't. I was lucky that they did. Is they can actually have a lymphedema therapist come right into the operating room and put your compression on for you. And that was a huge thing that helped me a lot because at least for the first 48 hours, they were able to just leave the compression wrap on. And that first 24 to 48 hours really is the most imperative because of the fact that you're going to be just getting up for the first time and starting to move. So if you don't have that compression on, it's going to potentially, swell into it, and you don't want that. So anything that you can do to make it as easy as possible, not only for you and your family, but also for the doctors and nurses who are taking care of you at the hospital, it's going to make it a game changer.
Thanks, Catherine. Anybody else have any insight or experience to share on the topic, post-surgical swelling?
I think the best way to manage post-surgical swelling is to reduce as much as possible before surgery. So if you can go into surgery with as little swelling as possible, and like Catherine said, compression ready to put on right afterwards.
Yeah, that's good advice. I'm getting surgery in November, the suction-assisted protein lipectomy, and my lymphedema therapist too. They said, come in, we'll do like a 2-week course of complete decongestive therapy to prepare you and get you nice and reduced ahead of time. So I'll be heeding that advice, Karen. We had 2 questions.
Can I just
yeah,
say
go
one
ahead,
thing
Nazreen.
really, really quick?
Sure.
So, you were talking about a seroma. So a seroma is just a little bit different. And a lot of times with the seroma, if they keep reoccurring, so after they do surgery, sometimes that skin just doesn't tamp straight down, right? And there's just these little pockets that can kind of fill with fluid, and that's what they'll call the seroma. It's different than lymphedema, but a lot of times they'll go in and they'll remove it with like a ultrasound guided aspiration. But what happens is a lot of times after that, the doctors don't have you wear any compression. And so that's oftentimes when it'll start to refill and refill. So even just after that, I don't know if that would help you, if you could make sure to get some compression. And yes, it is a little difficult and challenging to compress a thigh. I often see these seromas too in a lot of our breast patients, but silicone does really help. This silicone sheets to put that down, if that's helpful at all. And with a lot of our surgical procedures, I know we think of oncology procedures a lot leading to lymphedema, but the orthopedic procedures really do affect where those lymph nodes are, especially the knee replacement behind the knee. And then there's another little thing called the ventromedial bundle. It all gets affected. And so you are going to have swelling, unfortunately. And I'm so sorry that you've been dealing with this for so long. But it is something that we are going to anticipate. So if you can do your lymphatic drainage too, if you're taught that beforehand after surgery, I feel like it makes such a huge difference with that post-op knee swelling too. And just getting some good compression after they have a drainage of that seroma would be really helpful.
Thank you for that, because it was a very specific question. I'm glad you could weigh in on that. We got a question. I know Catherine wants to answer this one from our Staggy. They said, has anyone used a rebounder for lymphedema in the legs?
So I do have one that I use for my leg. However, before I actually purchased one at my house, I actually worked with my lymphedema therapist using one in their office to see, is it going to help? Number one, how do I do it in a safe manner? And how long, and how, is there any specific movements I need to do it with? And what I did is I actually found one on Amazon. I made sure I had the one that had the bar. So this way I could hold on to something without worrying about, am I going to lose my balance and fall? Because obviously that's not the purpose of it. A lot of times I don't really even jump. I just kind of bounce up and down without even picking my feet up off of the trampoline, to allow it just that like vibrational mode, to do it. And it really does help. I've actually, I've done like some balance exercises while standing on it, like doing straight leg raises out to the side and behind me, and just doing it on that, and incorporates engaging my core as well. Which if you engage your core when you're doing exercises, sometimes it can help the flow of your lymphatic system. But you really got to watch and document. And as Alexa always says, if she, has her book of notes, you really, when you're starting something new, you really want to try to make sure that you're keeping watch on, is my swelling getting larger? Is it getting smaller? Is there pain? Is there redness? Is there any changes in texture that I wasn't having before? You know, and keep an eye on, but only add in one major modality at a time and give it a chance to really see, does it work, does it not work? Because even though it may work for me, it may not work for Alexa or anybody else on this panel. So you have to see what works for you versus what doesn't, which is why before I chose to do it, I worked with my lymphedema therapist in her clinic to try and see if this was going to be beneficial for me. And then we tried it, not only just doing it, but did it work better if I had compression on, or did it work better if I didn't have compression on? And what time of day worked better? So it really depends on your individual body, because all of our lymphatic systems are very, very different.
Yeah, and that's kind of like our chorus every month is everybody is different. So just because it works for one person, as Catherine said. So thank you for that. That was really helpful. We are 10 minutes till the end of the evening, which time sure flies when you're talking about lymphedema. Karen, as mentioned, is going to lead us through a nice guided meditation to close out the evening. So before I pass it on to her, please know that we're going to collect all the questions we didn't get a chance to get to, and we'll do our best to get to them next month. Also, I want to plug real quick, we sent out a survey last week with the reminder promo email for the roundtables. We just want to do like a little temperature check on everybody and what you feel about the roundtables, any feedback, topics you're interested in. So I'm going to drop the link in the chat, but it'll also go out in the replay email. The survey is open until the end of August, and it'll take about like just less than 5 minutes to fill out. So if you feel moved to do so, we'd love to hear from you and your feedback. So with that, Karen, take us into our little Lymphy Zen moment.
Thank you. All right. So this exercise is dedicated specifically to Catherine, who is very bravely coming to us from her hospital bed, and kudos to you. So let's all just send a little bit of love towards Catherine here. Encourage her recovery. All right, so you can have your eyes open or closed, whatever is comfortable to you, but I'd like to have you just get into a comfortable space and take a nice, deep diaphragmatic breath. And if it feels comfortable for you to do this, I'd like you to put your hands over your heart. And you might feel your heartbeat. And I want you just to feel your emotional heart. How is it tonight? Does it feel happy? Does it feel sad? What sorts of feelings are you carrying in your heart right now? And just take a minute to see what's going on in your heart and how it's feeling. We've spent a lot of time in our heads, but it's nice to drop into the heart from time to time. And whatever you're feeling right now, I just want to honor that. And at the same time, see if it's all right to tune in to that feeling of love that you have in your heart. If you feel sad, see if that love can intermingle with your sadness and give you comfort. If you're feeling happy or excited, see if that love can add to that. If you're feeling frustrated, see if it's possible for that love to just hold the frustration. However you feel is perfectly fine. But see what happens when you add a little bit of heart love to that equation. We're not trying to make any feelings go away. we're just trying to add that super sauce of healing love to give perspective, to help us feel more grounded, to hold us, to guide us. And if it's all right, just see if it's okay for that love to start to spread throughout your whole body. What happens when you just allow love to flow and fill every part of you? And then if you want to try another thing, what happens if you allow that love to expand outward? You can use your heart to touch other people's hearts. You can use your heart to send love and healing to others, as well as to yourself. So taking another breath, I want to just thank you for playing a little bit and seeing what happens when you add the heart and feelings of love to whatever else is there. And if your eyes are closed, you can start to gently open them. And we're going to rejoin this group, and we've got a few minutes for us to close.
Thank you so much, Karen. This is becoming one of my favorite parts of one of my favorite hours of the month, is what I affectionately refer to as Karen's Corner. It's been so peaceful to end the hour with this each month. So thank you, Karen. And as a little plug, we've been putting some of these little Karen Corners on the Lymphedema channel on YouTube. So you can revisit them anytime you want and replay these lovely meditations and breathing exercises. So gosh, we've got 4 minutes left. As mentioned before, we'll make sure to take note of all the Q&A questions to address in September. It'll be a real back to school kind of session because we've got a lot of great questions to revisit. And the next roundtable is on September 10th. We are here every second Tuesday of every month at 8 p.m. Eastern Standard Time. Whether you can make it live or if you want to catch the replay, we encourage you to still register so that way you get the email right away as soon as I have it edited and posted on YouTube. And we just love that you spend your time with us each month. And we love that the panel comes each month too, and our special guests, Olivia and Dominique, whatever fire he's putting out right now in Connecticut. We appreciate both of you so much for being here with us, and all of you in the audience as mentioned. So gosh, we've got a couple minutes left. Anyone in the panel have any closing thoughts or burning desires to share, or any well wishes for Catherine? We've got a lot in the chat for you, Catherine. Healing thoughts and people holding space for you. And we hope you feel better by the time we see you next. Yeah. Olivia, I'm going to put you on the spot. Any closing thoughts for us? Because I think you've got such a beautiful mind and you've got great advice for living with lymphedema.
Yeah, I mean, I think my closing thought is community is everything. Finding community, being present within your community, and allowing community to touch your heart, just as Karen, showed us through that beautiful meditation that we did, is everything. Once you begin to accept yourself and you share yourself with your community, whether it is other lymphedema patients, whether it is allies, your CLTs, whoever it may be, you're just going to be able to blossom and bloom. And that's been something that's big for me. So thank you for welcoming me to this space today and having me as a part of your community. I think finding the online lymphedema community, it changed my life for the better. So I hope that we can all find that and find our support systems and find the love that we give back to the world. So I'll just share that. And thank you, Alexa, for having me and asking me and just being such a ray of light always.
Oh, well, I'm so glad you could make it, Olivia, and thanks for that. I love the imagery of us all blooming. And I was talking earlier with my boyfriend about the butterfly imagery and the whole idea of being in a chrysalis. And I think all of us, we kind of get into this chrysalis of getting that place of acceptance around our lymphedema and getting that confidence to come forth and be our beautiful butterfly lymphedema selves. So I hope everybody flutters away into the evening tonight, feeling a nice sense of community and support and positivity. And we will see you hopefully in September. So I hope you all join us again. And I thank you for being with us. So good night, everybody. Have a great evening. Bye.